Hi, this is Dr. Roy Kim. You may have heard about the deep plane facelift, and I think as a consumer, it sounds sexier, it sounds better, because you're going deeper and you're actually getting a better facelift. I'll tell you briefly what a deep plane facelift is, as well as what the advantages are compared to a traditional facelift. I'll also talk about the disadvantages of a deep plane facelift. So let's get started. Briefly, you should know the difference between a deep plane facelift and a traditional facelift. This is a short explanation. I do have another video that's a lot longer that goes into more anatomy. But essentially, a deep plane facelift, we're able to tighten the SMAS, the structure underneath the skin. SMAS stands for superficial musculoaponeurotic system. We're able to actually tighten it all the way from the edge of the eye, around the cheek area, the edge of the mouth, jowl line, and neck area. What that does is it gives a more comprehensive approach to facelift. Traditional facelift approaches, we're still tightening the SMAS, but we're usually limited. We can only tighten it sort of around the eye and the cheek area. It's difficult to get around the jowl because we're not really loosening up and going into the deep plane to actually loosen up the structures and then tighten it. And finally, we're actually able to go in the same approximate areas of the neck. So really a traditional facelift is lacking the ability to go deeper around here, underneath portion of the cheek, all the way to the jowl line. This is why it's called a deep plane. And there's nothing wrong with certain types of conditions for traditional facelift, but it's not always the best. The number one advantage of a deep plane facelift is that I'm actually able to tighten naturally and rejuvenate naturally the area of the cheek, at the edge of the mouth, the nasolabial fold, and the jowl. There's really no other technique that can rejuvenate this area correctly. I'm able to go deeper, lift up the correct tissue, and actually change the vector, the direction of how I'm tightening the tissue, and give you a very long-lasting result. There are actually a couple more advantages of the deep plane facelift. One of them is that it gives a more comprehensive aesthetic holistic result. We're not just rejuvenating sort of the majority of the face. We're able to rejuvenate all the way from the edge of the eye all the way down to the neck area. This is important because even though we all age slightly differently, the common areas are such that we want to rejuvenate the entire face. We can change the vectors or directions of the underneath structure, the SMAS, so that we rejuvenate the areas that are really bothering you. You may be the same age. However, your lifestyle, your genetics may have you as a person compared to another person have more loose jowls. We're able to correct that. Interestingly, the deep plane facelift actually has less swelling and less bruising. Remember, we are going underneath the SMAS in an area starting around here. Well, you notice that's not that far from where I have to make the incision in front of your ear or even behind your ear. So the actual amount of skin dissection is less than a traditional facelift. What that means is since I don't have to do as much surgical dissection, you're going to have a little less swelling in the bulk of the area. Because I'm able to lift up the deep plane in a much wider, more comprehensive area, you're actually going to have less skin tension when I close the incisions. This is important because this should result in actually less scarring as opposed to a traditional facelift. Traditional facelift techniques, I usually have to do a little more skin dissection. Technically, the skin edges, when I'm closing up your incision, has a little more skin tension. In theory, it should have possibly a little more chance of scar formation. Because I'm dissecting less skin, the blood flow to the bulk of the area of the facelift is actually better with the deep plane facelift. There should be fewer complications in terms of vascularity, in terms of the blood vessels that are feeding your skin right after facelift. The recovery should be smoother, and also you should be more assured of a better looking result. Now I'm going to talk about some of the disadvantages of the deep plane facelift. To me, these aren't really big disadvantages with the right plastic surgeon, but I will name them for the sake of clarity. First off, you will probably have a little more swelling around your cheek with a deep plane facelift versus a traditional one. The reason for this is we're actually able to comprehensively rejuvenate the cheek, the edge of the mouth, the nasolabial fold, and the jowl much better with a deep plane facelift. This is why I don't think it's a big disadvantage, but yes, in your recovery time, even though you may have less swelling and bruising at the edges, you may have a little more swelling around the mid portion of your face. But remember, you have that because we're actually able to rejuvenate it more effectively with the deep plane. Another thing that's a disadvantage, although I don't think it's a big one, if you actually don't have that much skin sag, you may not need a deep plane facelift. In other words, if you're a little younger, or simply we're doing a facelift where we don't need to rejuvenate as much skin and soft tissue underneath the skin, I don't have to pull as hard. I don't have to give as comprehensive of a result because you may not need it. So The traditional facelift allows me to remove some SMAS, to tighten the SMAS, to tighten it onto itself, known as plication. With these techniques, I'm actually able to give you a great result because you do not need quite as much rejuvenation around the cheek and jowl areas. To me, this is another known risk. However, I don't think it's really an issue with the deep plane. There are very few surgeons that actually do it properly, correctly, and technically. There are some plastic surgeons who claim they do a deep plane, but they're not giving you the full comprehensive result. To me, a deep plane is rejuvenation of the entire area of your face. And as long as you can pick a plastic surgeon and find one that actually does that, then that's fantastic. Another disadvantage, although I do think it's related to the plastic surgeon, is in papers, there's technically a higher risk of nerve damage. Every time we do a facelift, there's a risk of dinging or having swelling around the branches of the facial nerve. These branches give you emotional expression, whether you're happy, sad, etc. With the deep plane facelift, since we are going a little deeper underneath the SMAS, there's a theoretical risk of actually causing compression on these nerve fibers. Having said that, if you do see an expert doing deep plane facelifts, this risk should be very low and actually should be the same as a traditional facelift. Finally, the last disadvantage is that it will take a little longer and probably have a slightly higher cost. Doing a deep plane facelift in my hands still takes me a little longer than a traditional facelift, and there is a higher cost associated with the most aesthetic, the most beautiful, the most comprehensive approach to rejuvenating your face. Even though I think this is a disadvantage, I obviously think that you get what you pay for. You're getting a more comprehensive, holistic approach to your face. I hope you enjoyed this video. Here's another one you may like on my channel. And as always, if you have any questions or concerns, feel free to drop them in the comment section below. Thanks so much for watching.